Muskoka's first COVID death and another infection locally. A medical official from MAC speaks about the current situation in our hospitals. And local businesses team up to help out with the need for PPE. All that and more coming up right now. Welcome to Cogeco News for April 13th. I'm James Bowler with what's happening in your community. Well, over the weekend, Muskoka had its first COVID-19 related death. A man in his 80s from Muskoka Lakes died while in hospital due to complications caused by the virus. His infection confirmation was first reported on April 6th. Since then, another confirmed infection has been reported, which is the 13th in Muskoka now. A man in his 60s from Gravenhurst contracted the virus while in close contact with another person with COVID-19. He's currently in self-isolation. Meanwhile, in Parry Sound, an officer with the West Parry Sound OPP has been confirmed infected with the virus, the first for that detachment. That member is also now in self-isolation. And during his update today, Dr. Charles Gardner with the Simcoe Muskoka District Health Unit harped on the recent trend of cottagers deciding to make a trek to Muskoka despite multiple calls from multiple officials not to do so.
I personally have seen a photo that was sent my way of a bunch of cars lined up to go boating on McCrae Lake. So we forward that on to the police, and we're seeking clarification about routine enforcement about such. I think that was a dangerous situation where any of those individuals could have exposed themselves to each other. The potential for transmission is certainly high, and that's just one that I know of. There could very well have been many others. So if we see a surge related to this, you'd see it probably 2 to 3 weeks out because of the incubation period and the time it takes for people then to get sick and seek medical attention and get tested and then for us to get the result. You know, the Premier has advised that we stay home unless we have to go out. I've said, well, you should be able to go out for physical activity very carefully, keeping your physical distance, but if we're not careful and we end up with a big surge, we might find ourselves in a total lockdown. It is possible.
Now, earlier today, I connected with Parry Sound Mayor Jamie McGarvey by phone to chat about what's happening in his area. During the chat, Mayor McGarvey expressed his concern with the way COVID-19 testing results are currently being presented by North Bay Parry Sound Health Unit and cottagers putting local residents at risk by coming up.
We feel we have a right to know whether there are actual cases within West Parry Sound. And I don't think that is too much to ask. You know, we pay a pretty good chunk through the 7 municipalities in this particular area to the health unit. And I think they can hive off their results to let us know whether we actually have people with COVID-19 in West Parry Sound. I think it's reasonable to ask, and I think they should be able to comply. I've had the bureaucratic answer from them. I don't accept it, but so we are taking the next step to try and get those answers. Other places are doing it, you know, knowing whether, you know, your community or group of municipalities has a case or not. I think we should be able to do the same. You know, there is some concern with regard to people traveling back and forth, and, you know, this comes to people that want to head up this way for the cottage sort of thing. And I don't blame them for wanting to get, you know, out of the city and being cooped up there and that sort of thing. But, you know, there has to be some, you know, consideration taken into the fact that, you know, they could come in contact with the virus, which then in turn, you know, might pass it on to somebody here. We've got a large seniors population here, which is extremely vulnerable. So, you know, we have to be very cognizant of that. You know, I'm really concerned about the people that aren't paying attention to what's going on and are not self-isolating if they have come back from being down south. And, you know, moving forward with that, not taking the precautions in their day-to-day lives to social distance. Extremely important to do that and to make sure that you're not coming in contact with other people.
And tune into Cogeco News tomorrow. We'll have a response from the North Bay Parry Sound Health Unit medical official on Mayor McGarvey's concerns. And just before we go to break, a bit of a warning to viewers. It's quite windy out there right now. We can hear it in the studio, and be prepared for a windy night ahead. Environment Canada is warning the wind speeds could get up to 80 kilometers per hour, in some areas even higher. That means we could likely see some power outages in the area, as well as trees are pushed down, so be prepared for that. And we are taking a quick break, but when we come back, a look at how our local medical staff are faring during this pandemic. Stay with us. Welcome back. Last week, I had an opportunity to check in with MAC's Director and Chief of Emergency Medicine, Dr. John Simpson, who's also an emergency department physician at both sites. Dr. Simpson was able to give me an inside perspective on how medical staff are currently feeling amid this pandemic as they prepare for an expected rise in the need at the hospital sites.
So here at the hospital, all our teams are actively preparing for the surge, which we think is still yet to come. It's a lot of preparation work with planning of scenarios to meet the needs of patients who may have COVID-related illness or may not have COVID-related illness. So we're actively trying to plan scenarios and have the resources to offer and support those scenarios to look after everyone that potentially can come. It's a bit daunting to try and think of what may come. So we are trying to plan a robust strategy with backups and while still keeping in mind that our resources are somewhat limited as a smaller hospital, whereas a larger hospital could redeploy a larger number of staff to work specifically in surge. We're limited by what we have in terms of resources, so that always is kept in mind. As the tenure in the hospital also is one of concern that we all are living with right now, which is a unique one for us. So even though we're healthcare professionals and ready to look after medical needs, all of us are having to plan for our own families and planning how to isolate ourselves from our families and go into the community and get our groceries and do things in a different way when we've never done that before. So even though we're teams that have worked together in healthcare in a lot of ways, the added stress and the unknown added stress is a challenge that we feel here at the hospital as well, and as part of the community at large. I have two children who go to school here in town, and my wife also works in town and is part of well known at the Rotary Club and highly involved in many things in theater and around the community. So absolutely, we are Huntsville or Muskoka people who live here and work here and enjoy here. So we have felt all those different pressures and changes in the community. and really have tried to enforce and support the message of staying home, not just in our own social groups. Of course, we are doing that, but also to our neighbors and to our visitors to the area and to everyone that is here, trying to help support that. My whole family has done that, and even my teenage son has done that in running a drive for the food bank in a time of need like this. So we've come together as a family to try and do that. But obviously, it's a different time for us, like any family as well. There is some good science behind saying that as a frontline healthcare worker in a hot zone, as to use your term, doesn't really carry extra risk for us to transmit to our families. Certainly many of us thought that was the case, that because of where we work, we are higher risk to pass it along, or and higher risk to contract it as well. Really, that risk, because we are so careful and cautious at the hospital and planning and using our proper protective equipment on a daily basis, the hypervigilance that comes with that is probably something that is protective. It's something that we hope is protective. So I actually fear more going to a place in the community where I need to go than I do coming to work. That being said, as a family, we are preparing for symptoms to develop in myself or one of us, because I think any one of us could get ill, and planning our own self-isolation or quarantine measures. Some of us have rented extra places in town, specifically, so if we need to completely separate physically, we can do that. That also is sometimes for some staff members needed just for a mental break, so their family doesn't have to worry about them, that they're in a safe place and in a safe, clean place. Our community has been very supportive with that, which has been excellent. So the reach out from the community to try and help healthcare workers has been excellent. So that ties into supporting each other, supporting each of us through this is what we need to do, I think. And along with that, keep up our physical distancing, because we're not anywhere near through this yet, in my opinion.
And this is just another good reminder that if you don't need to be out, you should stay home, keep those people protected. They are, after all, the ones that will be taking care of you if and when you become sick. And we are back to the break, but stay tuned for a look at how a few community groups and organizations are helping with the need for more masks. Stay with us. Welcome back. A local manufacturing company in Bracebridge is stepping up to help the fight against the coronavirus.
We're a manufacturer of electronic interfaces. So we deal with a lot of companies like Boeing Aerospace and other medical and military manufacturers all across North America and around the world. In this time of crisis, manufacturing Canada has to come together. We have to all do our part. So we've taken a look at what equipment we have here and what we can do to help, and we've migrated a lot of our capacity to medical shield manufacturing. And what we're trying to do is use, to the best of our capabilities, the ability to help protect our frontline workers in this time of need through making clear shields and whatever else we can do. We have parts we're making for respirators here as well right now, which has taken first priority, of course, in all of our production lines. Working with local dentists, with the COVID-19 intake centers and assessment centers and the hospitals, we've been trying to migrate and develop the best design possible.
There's been a lot of resources put into masks and gloves, different kinds of masks, different kinds of gloves, the gowns. There's been millions of dollars of Canadian resources into that. But then the face shield at the beginning of it wasn't as much as of an issue. But today, if you call any of these colleagues of mine, which I've done, the first thing that they say is that, where can we get shields? And when I came and saw what Andrew and Rick are doing, I was first of all impressed by the level of sophistication in their designs. There were a couple of things that I thought that if you add to it, it would definitely help not only the frontline medical workers, but the frontline dental workers. For example, we implemented a little bit thicker foam so that the dental glasses and goggles and the lenses that the dentists are using can fit into it.
It's been an incredible challenge, not only having to figure out a design, having to work through government rules and regulations on that, reorganizing our facility and adapting to medical standards in terms of masks, gloves, which we all need to be doing right now anyways as part of the global situation. But in this, we needed to take it another step forward. It's also in this time when it's unfortunate that a lot of people are having to stay home and a lot of businesses have had to close. We've been having to find new staff to help. So we've brought on several new hands, and we'll be looking to bring on more new hands, new team members throughout the upcoming week or weeks to jump on board and help increase our production capability and get more of this much needed equipment in the market.
So I think for me, I'm not using a lot of my dentistry skills, but a lot of things that Andrew needs here is just generally labor. So we cut things, we move things, we put things in the back of trucks, and we would need help eventually. I've reached out to my team who work for me in my offices and reach out to them. If we can't offer them any employment in our offices, this is another venue. We're looking into bringing some of them back here and help us.
So we're trying to cover our costs, and we're hoping that the government will step up. We've been talking to our MP and our MPP here in Parry Sound, Muskoka, and we're hoping everybody can reach out and let them know that local manufacturing needs government help. Where centers in Toronto or the bigger cities have a lot of support, Northern Ontario has been left behind, and any support we can get from the government in Northern Ontario would be greatly appreciated. So if you can reach out, please do.
Really amazing they're doing that. Well, we are going to take another break, but when we come back, a look at a local community group doing its own part to help with this COVID-19 pandemic. Stay with us. Back last week, Canada's public health officials recommended that if you would like to wear masks, you should, but it's more for the protection of others, as non-medical masks are not proven to protect you from the infection. However, they can stop you spreading the virus to others. Well, a local group is trying to help give more people that power to help protect others.
Yeah, I'm delighted to tell you about it and your listeners about it, Samantha. It's very, very exciting, and it makes some of us who are involved feel very good that we can give a very small portion back to our town. What it happened at the end of last week, it happened very quickly. We came up with this idea that was sent up to us from the city of Toronto. One of our daughters works at a hospital, and she said they're doing this, and I thought, ooh, let's do it in Gravenhurst. So we got in touch by email with a number of gals in town to find out if they had free time, surprise, and perhaps some materials and so on that we could share, and we could start making these masks. It took off very quickly, Samantha. In a matter of about 3 or 4 days, we had 30 sewers and about the same number of people that weren't able to sew but happy to donate materials and to deliver them where needed and any way they could, cut out the patterns any way they could to help. So in this short time, which is very fast, we have over 60 sewers in town, and we have about the same number of assistants. So what's happening is we are collecting material all at Pem McDivitt's. She's in Pine Ridge, and she's very, very happy to use her, I call it her Pam's porch. And she's going to be storing all the material there so we don't talk to one another just even at a distance. Our sewers can go to her home, pick up the materials, whether it's we use 2 kinds of materials for these, Samantha. We try to make the 2 materials different. We have the outside material, which we hope is a pattern, and then the inside that's next to your face that we use as a very soft cotton, like a t-shirt material almost, so that's next to your skin. We took our first batch of 42 to the Manor in Gravenhurst. We obviously call ahead and find permission and ask if they indeed want them, find out how many workers they have, staff, shouldn't say workers, staff they have, and we were told they had 20. So we said, well, let's supply at least 2 per staff. So we deliver them outside. The people we want to try and get them out to first, Samantha, are we want to get them, of course, to our homes, and then we want to get them to some of the workers, like our wonderful people that are at our grocery stores and so on. I know they have plastic between us, them, and the customer, but still, perhaps they might feel comfortable wearing these kind of masks. We've decided just to use the one email address, and that's mine, and just keep it kind of all together. And it's Marv, M-A-R-V, Barb, McCabe, M-C-C-A-B-E, @gmail.com. So we'll just use that, and then from there we expand out to our the rest of our workers.
Well, we are taking our last break, but when we come back, a look at what made headlines today. Stay with us. Welcome back, and as promised, here's a recap of today's headlines. COVID-19 has claimed its first life in Muskoka. A man in his 80s from Muskoka Lakes was killed by the virus last week. Confirmation of his death came from the Simcoe Muskoka District Health Unit over the weekend. He did die in hospital. And another person in our community has been infected by COVID-19. A man in his 60s from Gravenhurst who came into close contact with another infected person. He is in self-isolation. And a member of the West Prairie Sound OPP has been infected by the virus as well. This is the first reported infection for that detachment. The officer affected is in self-isolation. Your TV wishes them a speedy recovery. And don't forget to stay up to date on all COVID-19 related issues locally by watching Your TV live at 5. You will want to tune in tomorrow as I'll be joined by Health Minister Christine Elliott to answer a few questions on the local impact and some of the recent changes provincially related to COVID-19. That is Cogeco News. For more information on the program, head over to yourtv.tv or connect with us on social media by searching Your TV Muskoka. Remember to catch us live at 5 Monday to Thursday. And from everyone here at Cogeco News, thanks for watching. Stay safe, stay home, and stay healthy.